Yes.
So we'll try to run it. Mostly, I think what we can do is I can do my presentation part.
जी जी
Because we won't have many people to discuss for panelists. Maybe I can ask
Then
you.
you can.
What is that?
Didi, nice. My rehearsal will be done.
Yes.
And then in the evening, we have time slots like you have given 8:38. In that, I think everyone can come.
Yes, that will be shift 2. So for shift 1, we'll do it now. I think your role is mostly in shift 2, isn't it?
Yes, Didi.
So anyway.
But then I thought it is possible within the college also. Then I thought, why not to join now?
Yeah, very nice that you could join.
So, Ranjita Didi, if someone joins into the attendee and if that person is intended to the panel, so just move them to from attendee to panel as well. And,
yes, yes,
and I'm right, Ji. Okay.
We can start or not yet? So today the anchor is not available. So I'll just act like the anchor has introduced me and I'm doing the moderation. And I will then do the presentation. And then you can be the panelist. And I will also have to introduce the panelists, but I don't have your profile in front of me because I had to print them out because I won't be able to see my screen. So anyway, we'll see whatever we can do. For the evening part, I will tell Mirunalini ji, maybe she can print and keep everybody's profiles. So it will be easier. Rather than to try to share the screen as well as have something else going on screen. That seems little difficult, at least challenging for technically challenged people.
Yes.
So, okay, we are almost there. It's 11:29. So the PhD is there. Would you like to be anchor for now? Since Prajita ji is not there. Okay, never mind. All right. So I will assume that Aprajita ji is introduced me. So thank you, Dr. Aprajita. Welcome to everybody for this special interest group in health for the panel discussion on need for holistic human health. Before we go further, let me just take a moment to introduce some of our esteemed panelists. And then I will give a brief description of how we are going to be conducting this panel. So we have with us today Dr. Saroj Jayasinghe from Colombo, Sri Lanka. Dr. Jayasinghe is a fellow of the Ceylon College of Physicians, National Academy of Science and International Science. He is an emeritus professor of medicine and a specialist in internal medicine. He is one of the longest serving consultant physicians at the National Institute or the National Hospital of Sri Lanka. And in the 1990s, he played a pivotal role in reforming the curriculum at the Faculty of Medicine, introducing behavioral sciences into medical education and promoting a more holistic MBBS program. Further, in 2018, he organized the first international conference on medical humanities in Sri Lanka, setting the stage for integrating themes of humaneness, such as empathy and compassion and the arts, into the curriculum. He coordinates the global network on health humanities. Welcome, Dr. Saroj. We're very glad to have you, honored to have you here with us. Then we have Dr. Tanine from Bangkok, Thailand. She's a professor of pediatrics at Chulalongkorn University, Bangkok, Thailand, and did her training in pediatrics and pediatric endocrinology from the same university, after which she did a 2-year fellowship at the University of California, San Francisco. And now she is Assistant Dean for Graduate Affairs. She is a member of the steering committee for the School of Global Health at Chulalongkorn University, where she is responsible for the clinical sciences program and developing the global health curriculum. She has an active role in the development and implementation of humanistic medicine and education in Thailand. Her commitment to pediatric global health, education, and improving healthcare systems has had a transformative impact in Thailand and internationally. Welcome, Dr. Tanine. Honored to have you with us. Then we have Dr. Rajalakshmi Iyer from Mumbai, India. Dr. Rajalakshmi graduated from the Grant Medical College, Bombay, and then went on to do specialization in rehabilitation medicine from Madras Medical College, Chennai. She started her career from Christian Medical College, Vellore, moved to St. John's Medical College Hospital, Bangalore, where she worked for 17 years, and then moved to AIIMS, Rishikesh, where she set up the MD program there. At AIIMS Rishikesh, she started and headed the Department of Medical Humanities there. And she dreams of the day there are fellowship programs in medical humanities in premier medical institutions in India. Very nice thought, Dr. Rajalakshmi. She is presently on a sabbatical from work to care for her parents. We welcome you, Dr. Rajalakshmi. Very glad to have you here with us. And then we have Dr. Swapan, who is here from Ludhiana, Punjab. He has spent more than 25 years in working with students and faculty. He has also been taking a keen interest in the universal human values programs and trying to bring that into education with a lot of success. And I'm sure he has a lot of experiences to share regarding that. Welcome, Dr. Swapan. So before we go ahead and plunge right into the program, I think we can briefly talk about what the running of the session will be like. So as we have already done the introductions, now I will be presenting a small portion of like a recap of some things that were already discussed in the keynote session this morning with a little bit more detail. After which we will have some questions that will be put forward in terms of views of our esteemed panelists. When the question is put forward, each panelist will have approximately a maximum of 3 minutes to respond. So kindly bear in mind the timing so that all panelists may have a chance to be able to share their thoughts. If we exceed the time limit, there will be a small timer that goes off to indicate that you have gone beyond your time. And if that happens, kindly try to close quickly so that we can move on. If possible, we will do 2 to 3 rounds of these discussions, after which we will open the questions to the delegates and maybe spend 10 minutes to take delegate questions, for which, unless a specific panelist is asked for, any of the panelists can respond. And beyond this, then we'll be closing the session. So this will be the format. Now, let me from my side share the screen and share with you the discussion, a brief recap of what was discussed in the morning keynote, and further some few more details. So if we are looking at health, since this is a discussion on health, if we look at the WHO definition of health, which was put way back in 1948, health has been defined as a state of complete physical, mental, and social well-being. Further, if we look at our traditional wisdom of Ayurveda, it is also mentioning health as complete physical, mental, and spiritual well-being, a total psychosomatic equilibrium, if you will. So looking at these definitions of health, one must ask the question, are we addressing health adequately today? If we look at our achievements in the past, we have been able to get rid of many of the communicable or infectious diseases, at least reduce them drastically. If we see specifically in the what we would call the developed countries, the risk has gone down tremendously. COVID is an exception, but we can see that it has been brought very quickly under control. Antibiotics have revolutionized medical care. What care was like before antibiotics and then post-antibiotic era will show this in so many ways. Vaccinations have led to eradication of diseases like smallpox. And polio also, we have been able to sort of, get rid of it from India, although total eradication is yet to happen. Trauma care. This has also gone through a revolutionary change with advanced state-of-the-art techniques, surgeries, and other procedures that are saving many lives. However, with all these achievements, there are also some concerns which are concerning, to say the least. So concerns regarding the non-communicable diseases, which are a leading cause of death worldwide. If we look at India alone, approximately 5.8 million people are dying from NCDs every year. 1 in 4 Indians has the risk of dying from an NCD before they reach the age of 70. Of course, I don't need to talk about these big killers. It's not just India. These are leading to global deaths. Now, if we look at mental health, in 2019, WHO statistics say that an estimated 200 million people, or 5% of adults worldwide, had depression. These are sobering statistics. Suicide was the fourth leading cause of death among the 15 to 29-year-olds globally. And this is a global phenomenon, including those of the middle-income countries. Now, all of this also has an impact on the physical health. Medical research estimates that as much as 70 to 90% of illness and disease is stress-related, whether it be high blood pressure, cardiovascular disease, ulcers, stress-related problems, and so on. Again, we need to look at this question, are we treating mental health adequately? Or is there perhaps something we are missing here? For instance, what is the root cause of stress? And how can we overcome it? It is quite a challenge. As mentioned, stress is the common risk factor in 75 to 90% of diseases, including those diseases which cause the foremost morbidity and mortality. So how do we deal with this? So if we look broadly, there are some concerns regarding the health of the people. There is an alarming rise in non-communicable diseases. Stress and mental health issues, they are at an all-time high. And of course, there is impact of mental health on physical health, leading to issues there too. Then there are concerns that are regarding our health education and healthcare systems. So in our health education and healthcare systems, is our focus on being healthy, or are we focusing on getting rid of disease? Even if we look at diseases, are we curing the diseases, or are we managing diseases lifelong with medication? And again, are we addressing mental health adequately? Or are we using mostly medication which is being given to the body? So are we really addressing mind and body adequately, or is our focus largely on the body alone? Then there are more fundamental concerns regarding values and ethics. As healthcare professionals, are we service-oriented, compassionate to the needs of the sick, or has our focus shifted largely towards profit maximization? Do we look at ourselves as isolated entities or as a part of a larger whole? Is the lack of concern for nature also adding to the disease burden? And if so, is it not our responsibility to educate our medical students about this? All in all, there is a concern regarding the sustainability of the healthcare system. Is healthcare becoming overly expensive and out of reach for many? So is it really sustainable in its current form? Now, if you look at this, despite all the time, resources, the billions of dollars, the effort spent on health, why is this happening? Is there something we are missing? And what are we teaching our students? Is there a need to question our medical education system itself? More fundamentally, is it time to question the very perspective of health we are giving in education? So one approach could be that we deal with symptoms. Another approach could be we deal with the root cause. So for instance, today we may be reducing blood sugar for diabetes, reducing blood pressure in hypertension, reducing pain and inflammation in arthritis. and so on. But what about curing these illnesses? Are we aware of what exactly is the root cause behind these? If you see, we are giving relief from the indicators. In other words, we are suppressing the indicator. But this is not really correcting the disharmony in the body. So with all our research, why are we not able to find the underlying root causes of disharmony? We need to question our perspective here. Is our perspective right? Or is it time for a more holistic perspective on health? So with this, I think I will take the views of all our esteemed panelists. There are some fundamental questions that we need to look at. So first of all, this question that we looked at right at the beginning regarding the definition of health, complete physical, mental, and social well-being. Do you think we are addressing health adequately, Dr. Swapan?
Greetings to all. Really an eye-opener, the presentation, Dr. Shamila. I mean, the statistics you have given about non-communicable diseases, it's very alarming. So very nice. So yes, even our definition is saying, like you have defined the definition given in Ayurveda and even our medical, that mental health, and even when you talked about Ayurveda, spiritual. So they are, I think, the two very important aspects. But I think with the time, they have left behind. What my feeling is, because your presentation, and even if we see in our surrounding also this, that we can see that today, like you mentioned in your presentation also, that these non-communicable diseases, the reasons for that, maybe the mental and all stress. And yes, the communicable diseases, they are chronic. We are overcoming them very nicely. But then what about this part of this? And I think this has to be taken care of. And only if we are considering to manage them, they are not being managed. Again, you have given the statistics like about suicides and all that, alarming statistics. And they are all, again, I think we are not looking at the solution. So I think high time to see the mental aspects and spiritual aspect. Body, we have given a lot of research, and as you mentioned, that many researches, and we have achieved a lot. But then can we prevent these non-communicable disease? Answer is yes. But then perspective we have to see overall. Like even you said in the last presentation, last part of your presentation, that even this your nature and all that. So I think the whole perspective is about the materialistic or the body. So I think that view has to be changed, and we have to come back to that healthy mind and means spirituality, so that we can have a means we can even control these non-communicable diseases by taking care of our body. So I think this is high time. Nice. This is what it is needed.
Very nice, Dr. Sapan. Glad to have your views. Dr. Aprajita, if I may ask you, some of these non-communicable diseases like diabetes, hypertension, do you think we are mostly curing these diseases or largely managing them with medication lifelong in an attempt to avoid complications? What are your views on this, Dr. Aprajita?
Yeah, thank you. Greetings to all. As we see increase, as you have mentioned, that increase in the cause of death due to non-communicable disease, A lot of effort has been put as far as the communicable diseases are concerned, as you had mentioned. We do see this. Diabetes, we say when the patient happens to come to us, we generally see how the blood sugar levels can come down. But why exactly did the blood sugar level go up? Are we looking into that as well?
Yes.
So maybe we are just seeing how it will go down. But why? What was the cause of the sugar level going up? Are we looking into that? So I think mostly even the patients are also coming up and telling me we should reduce this blood sugar level. That is what is the expectation of the patient also. So somewhere to educate the patient as well as the perspective of the doctors also, we'll have to see that completely as a society, are we looking into just curing just seeing that symptoms goes away? But what happens at the root level? I think it is very right, and I think we should be looking into it. That is what I would say. And it's a nice. We like the perspective has to change, as you said, so that finding the root cause of how not just reducing the blood pressure, but also what is the reason why this happened. So very nice to see what would be the solutions to that. Thank you.
Thank you, Dr. Prajita. Good that you are also of the view that perhaps we need to look at our fundamental perspective in all of this, because we are making so much effort, and somewhere there is a block, somewhere that we are not able to find the answers. Obviously, if the root cause is not clear, then solving the issue or getting to the root of the problem and going beyond that will be quite a challenge. True. Dr. Dipesh, mental health issues are at an all-time high. We talked about globally 70 to 90% of people being stressed. If you look at 2023 statistics in India alone, 74% of Indians suffered from stress. 88% had some anxiety disorder. Considering these statistics, do you think we need to reconsider our approach towards mental health?
Namaste to all. So nice that we are able to reflect upon some of the, I think, very crucial missing links. Probably all along we were thinking that the modern medicine and the path which we were taking forward would have resolved most of the issues, health issues, what we are facing now. But then we realize the hard truth that that is not what is happening to, and we are seeing a missing link also. And then we are looking into finding out more crucial reasons why these things are happening. And one of the crucial, most important part is the what we have seen is the issue of the rising stress levels. And then that is only the one part of identifying that the stress level is impacting the body in terms of diseases. And then that itself is a very crucial point. We generally were not having this problem of stress in older days. Now we have started realizing that that is one of the crucial problems of many of the health issues what we are now seeing. And in that context, I would see that the effect of the stress on the body in terms of diseases is something which we should very neatly or rightly consider. And I think we need to definitely work on that, considering that one of the very important reasons. And if you look at the numbers which you have put forth is alarming. It is truly, I think we are on a very important juncture where we have to really understand that and try to find some solutions from that perspective to address the stress part also. And taking a pill or going for a surgery or anything may not help there, but we need to find more holistic solutions for that. So that is what I think, Dr. Sharma Asthana, regarding this. I think that we need to address the stress, and this being one of the most important reason for many of the health issues right now, even for the children. That's what I'm trying to see, and it's so alarming and painful
Yes.
to see that. Yeah, that's all
Yes.
from my side.
Thank you, Dr. Dipesh. I'm glad you brought this up, that even our students are having a lot of stress now. In fact, younger and younger children, at a time when they should be enjoying their childhood, they are being stressed with whatever our expectations are from them, academic or whatever else. And dealing with this has become somewhat of a challenge. So very nicely put. Dr. Swapan, do you think the healthcare system is accessible to all? Do you think it's sustainable in its current form?
A very nice question. We have been able to see that there's a huge pressure on our health system also, means even you see the hospitals. I see locally, I'm an industrial town in Ludhiana, and Ludhiana is considered to be a very developed city, and sometimes its development is also measured with these hospitals. So every day new hospitals are coming up. But then we have to see that can that be the means from point of view the development, or we are not taking care of our health. I always discuss with my fellow beings. Uh, yes, they are coming up, but then patients are also increasing. And as you put up the statistics, that many diseases which we can prevent by just having this holistic view. And if they are not coming there, then obviously the people, I think they are overloaded by these psychomatic diseases because they're coming again and again. Like the stress and all these issues are reoccurring because we are not treating them holistically. So whenever it comes to the body, we treat the body with some medicines, but then uh, we are not going to the root cause, as even Dr. Aparjita and even my fellow being Dr. Dubesh said. And so till that, I think anything you do means you keep on putting on more hospitals and even all clinics are full. But if the patients are not taking care of themselves and spiritual well-being and this mental well-being will not be taken care of, then it will be really difficult, I think, to keep on making the new hospitals. But then people will keep on coming there, and then what will happen that it will become out of reach for the common persons, even with the chronic disease. Because if there are so many hospitals are full with all these non-communicable diseases, which can be prevented by this new perspective or holistic perspective, then I think it will be difficult for even the common person to have all the facilities, even if you are increasing the hospitals and all that. And even you see the prices are also going up. There's again a demand and supply. So I think presently, I don't think it's adequate, first of all, because we can see the doctors ratio and all the population. But then I think this non-communicable diseases will prevent them. Then I think it can be taken care of. Otherwise, I think they are not adequate and they will not be adequate because of all these diseases which can be prevented if we are not preventing them with our lifestyles, holistic way. So I think then it will not be adequate. We have to see from this point of view also. Thank you. This is my point of view.
Yeah. Thank you, Dr. Swapan. I think what you have raised, perhaps the others just to let the others know, Dr. Swapan has been experimenting with these holistic perspectives as proposals and has had a lot of success. So he talks from experience. But perhaps tomorrow we'll get a chance to look at the vision for this holistic health and get an idea of
Yes.
what kind of perspectives are being talked of here. Meanwhile, Dr. Aprajita, do you think we should be looking at mental health states before they reach a crisis or disease state? For instance, should we be addressing happiness, satisfaction, and so on also when we consider mental health, rather than wait till it becomes like a crisis, which we then label and try to treat? Yes, Dr. Aprajita.
So I do see the concern that you're saying that because we are able to see so many, as you also mentioned, that the increase in depression, stress levels, as the Dr. Dipesh was also saying, how small children are also like having this stress. But we got to definitely deal with them before it becomes a disease or it becomes a crisis. But I was just, a lot of work is being done, but how do we really do it effectively is what I have a question on. A lot of work has been done still. How in this conference we are proposing it, I would like to look into it as well. That is what I was saying, because that is a huge question that I have. Because whatever we are doing, we are not dealing with it adequately. As you can see that these numbers are going up, it is a concern. That is what I can say right now.
Your mic is muted.
I was checking
Sorry
my
about that.
system. I thought it went. Ji,
What's that?
I was saying that, thinking that my system is only
No,
not
no, no.
working.
Actually, a lot of background noise is there. So I had turned off the mic and I didn't quite pay attention. So I think, Dr. Prajita, that is a very valid question that you have. How do we actually go about it? But I think if we can see that the need is there, that some sort of change for the better is desirable, then tomorrow we can look at the vision of holistic health, what proposals we can look at as a change in perspective. And then on day 3, we will talk about implementing those proposals. So certainly it is a very, very valid question, most important, but we will slowly get to it, I assure you. So thank you. Dr. Dipesh, what do you think about this question regarding lack of values today, lack of compassion for the sick, for the infirm? As health professionals, our profession has been given a lot of significance in tradition, that patients would think of doctors as what was termed as next to God. But then today, do you feel that this has changed, and are doctors and other healthcare professionals having this compassion for the sick and infirm, or is it lacking? What do you feel?
Right. A very pertinent question again, put forth something which need to be discussed. And before going to that, one point I thought of adding to the question which you have asked Dr. Aprajita regarding the reflection of the health-related issues, whether we should be seeing it at an early stage. So one point I thought of making here regarding that is that if you look at many of the what do you call, the lifestyle diseases, when it arises, when it becomes and comes out of it as a disease, that might be a long way before that in the habits of that particular person in terms of not having self-regulation. So he was not, he or she might not be taking care of his body for quite a long time, not exercising or things like that. And probably years after that, it will be getting reflected as a disease in his body. So, and connecting to the same thing to the question which you have put it to me right now, like, is it regarding the lack of values? One part, yes, if that values were inculcated in the education at a very young age, many of these diseases would have been avoided. That was the first part. So maybe said after 5 years down the line, if a disease has come, the root of that might have started in my habit, in my not taking care of my body 5 years before itself. That is getting reflected now. And then that is one thing which I thought of sharing. The other part is about the lack of the compassion from the perspective of the healthcare professionals. And that also seems to be a very relevant question. Sometimes we say that, you know, when we go for a patient and just having a fruitful interaction with the doctor itself solves many of the issues that we can see. And a compassionate touch or a compassionate interaction with the doctor itself resolves many of the issues, especially if you see the case of children and anybody. So that part is also important along with the medicine part or the treatment part, that somebody is there to take care of me. And so that is also a very pertinent thing. But somehow, because we started the medical practitioners have started seeing it as an industry, as a source of revenue, achieving goals, achieving targets, and the doctors having the targets on the imaging facility they have brought, the infrastructure they have bought, all those things. So when it becomes pakka into, I mean, directly mapping into the financial aspect, too much on that would has definitely changed the way the doctors have started seeing patients, and then patients losing trust on the doctors, all these things, and the patient-doctor relationship moving into a what do you call, a customer and
Yes.
a boss kind of, a businessman kind of a relationship. So these things also is reflection of the lack of values. So if the doctor during his education has been brought up with their values and he is practicing that values, definitely he will correlate both the part of the compassion part, understanding that the person or the patient who is sitting in front of him is a human being and he is also similar to me, right? And he is also looking for happiness just as me. So that makes a lot of difference, similar to what we expect from teachers also. So this is what I thought of a point to be discussed along this, Dr. Sharma.
Yeah, very nice, Dr. Dipesh. I think what you have raised is very true, that to begin with, you know, when we talk of conditions in the disease state, as opposed to what we label as normal in society, whether it be physical health, whether it be mental health, I think it is very true that what we label as disease is just the tip of the iceberg. There are many, many, many cases which are simmering just below that tip of the iceberg, which will break through, you know, any moment with the little bit of stress. So it's, I think that is a very valid observation. And I think somewhere we need to see what is happening there too. before people go into breakdown state, when they are feeling the stress, what are we doing about that? How to address that? So definitely, I think that is a valid question. And when it comes to values, so sometimes it is talked of that, values have deteriorated overall in society and doctors are no exception. That's very true. But if we see whether it be education, whether it be health, whatever may be the field that we are in, I think one of the fundamental things that you also mentioned was, do we see our relationship with the other person? What if this was my family member? Would I have the same approach? Or would I have a different approach to that? And no wonder that the opinion that patients had for doctors earlier is shifting. Things are changing. There is lack of faith today that patients have in their doctors. But then on the other hand, there are many, many doctors who are also very committed. We have several here on the panel itself who are doing so much work for humanities. So how do we strike a balance? How do we bring about this change for the better in our healthcare professionals, in the society at large? Those are some fundamental burning questions that I think tomorrow we may get a chance to address these. But for now, if we can just see the desirability of that improved state, I think a stage is kind of set for the discussion tomorrow, which I think should be interesting. So I think we are almost out of time regarding our discussion, but perhaps now we can open the floor to the delegates. If anybody has a question in the audience and you would like to raise the question, please do so. We can perhaps take one or two questions. If you have a specific question for a specific panelist, you may mention that. Or if you feel that anybody can answer, then we'll request the panelists, whoever feels up to answering that, we'll ask for their opinion. So anybody from the audience with any questions? I have a question here. The audience, do they have mics or do they have to be provided the mics? I think they have to be
For the
provided.
attendees, we have to provide the mic.
Yeah, okay. So anyone from the audience, the attendees who are having a question, kindly raise your hand and we will pass the mic to you.
I was just thinking, like, a lot of work has been done as far as these questions are concerned, like health expenses are. What we could see is that a lot of people are now educated to have more mediclaim and all of this. I think that also has to be looked into, how people should save so that they can bear the expenses, because the hospital expenses are going up and not everyone is able to get those kind of high-end treatment that are available. So what are we doing also about, educating them to how to bear their health expenses? Even that should be discussed, I think so.
Yes. Is your question to any particular panelist or?
It is open to anybody can answer that.
Okay. Dr. Swapan, would you like to take on that question?
Very, I think, a nice and important question, because today people are worried about that. First of all, they're all worried about what will happen to their health anytime, because they also know that there are issues. And then the biggest worry is that you are sick, you will be sick, and then how the expenses will be met. And here the insurance companies and all Mediclaim are being encouraged. But then again, it is again a business. Even these companies, if you see, uh, so means it's not easy to get, means premiums have to be paid, and then again, the stress is there to earn that money. So I think again, we have to see the holistic perspective that how can this all be prevented so that we don't even need these mediclaims, extra money which we need, and then we have to do a lot of struggle to earn that. So very nicely in the last discussion when you were having with Dr. Dipesh, in older times there were relationships. We were living in a joint family because I come from that background. India, Punjab was known for the joint families and all living together and taking care of them in their this need also. But right now, I see even in my Punjab and whole India, it's again coming that people are becoming individualistic, joint families to nuclear families. And obviously, even they don't have the relationship like trust on each other and all that. It's materialistic. So I think then they need the money from this mediclaims and all that. So my point is that yes, you need if you're living in nuclear families, mediclaims are needed. If nobody is there to help you, at least money stress is not there if you're sick. This is how the insurance companies are promoting that. But I think because this conference we are looking at holistic view. It's just again a problem symptom. Point is this: we are not able to live with compassion, relationship with each other. Otherwise, I think these mediclaims can be taken care of by the relationship. People are there. We have examples in our society, various societies, in other countries also. We are taking care of each other. So this is my point of view. Thank you.
Very nice. Dr. Prajita, is your question somewhat answered?
Yeah, just brought my attention towards like so much of mental health problem is there because the relationships are not there. So as sir was saying that Dr. Sopan was saying that joint families can help. So I can see that yes, but how is it going? How are we going to deal with it? That is what I was thinking and looking forward for it.
Yeah. Thank you. I think these fundamental questions, when we look at them, it comes back to how we perceive things. For instance, if I see another as somebody related to me, I might have a different opinion and a different approach to them. Whereas if I see somebody as unrelated, then I may not have compassion towards them. And so on. I think these are some fundamental things that ultimately we have to question how things have gotten to this stage and what we can do about it. Even if we look at expenses in healthcare, if we see, as Dr. Swapan was mentioning, about insurance claims and so on, it kind of gives a lopsided view because many of the insurance claims are not passed unless it involves hospitalization. So does that mean that it encourages hospitalization to some extent? I mean, we've all seen that in our practices, that insurance will not cover outpatient expenses. But ultimately, fundamentally, you want the well-being of all these patients. So what would be the best solution for something like that? So perhaps we can brainstorm about this also tomorrow when we talk about the vision for holistic health. So looking back, I think, maybe we have time for another quick question. If somebody in the audience, in the attendees, has another question for any of the panelists or a general question that any of the panelists could address, then we would like for you to raise your hand so that the mic can be passed and we can hear you.
Namaste, Didi.
Namaste.
This is Manishi.
Yes, Dr.
Um,
Manishi.
This session is very precious for everyone on this planet to ensure health. But then, because of ignorance, we have assumed ourselves to be the body. And the entire health system has drawn up to taking care of the various parts, various organs of the body, the ailments or the symptoms, addressing the symptoms. And not just this, along with it has come lots of myths regarding various pathies that are there prevailing today. Like yesterday only, my husband, he is very anti to natural remedies, naturopathy or Ayurveda. So he said that it is, let me switch on my video also.
Yes.
He said that it is only allopathy which he has experienced and observed has saved his parents and made them live up to age of 89 and 86. Had they gone dependent on this allopathy, Ayurveda, they would have, died very long back because they suffered this what we say sugar, diabetes, and heart related diseases since 40 years. So he said, I have this proof with me. So I kept silent. I mean, though understanding the value of holistic health, and I could see to it, but I had no answer to it. So all such issues of ignorance regarding medical sciences, regarding various pathies, how can they be addressed?
Yeah, very good question, Dr. Manishi. I think, somewhere we have to also look at, are we going to address health, or what are the parameters we are going to use for health? Is it just the longevity, or is it also the quality of life? And if we look at both, how much weightage would we give to the quality of life and how much to the longevity? And I think that is also one of the fundamental key questions that perhaps one of the other panelists would like to answer. One of our panelists, would you like to respond to this question?
Even I had a question because what we see is even I saw my mother, like she was, when she got hospitalized, it was the ventilator that she was, you know, uh, she had, and the doctor said that it's not possible to take away the ventilator. And then there was this another doctor of his, who said that, no, it is possible. And then he made it, my mother to ship to that hospital. And then he says hot to it that how in 2 days itself she was able to do without this ventilator. So I was thinking that what is are we wanting the person to just exist in that state, or do we want the person to be healthy? Like, so these ventilators, what is it going to do? In a vegetative state, a person is going to just be there. So even that question is there, like, do we that longevity or the quality of health? That is
True. Very true, Dr. Prajita. I think somewhere we have to look at, this question, like you mentioned, about longevity versus quality, or both. Can we have both? Because generally, if a person has been taking care of the body and all, they are likely to live long. But on the other hand, there are many instances, like your own descriptions, that somewhere along the line, one gets sick and quality of life may deteriorate. So then what do you do? How do you, and so, people have brought out some some ways of perhaps having a living will, which will make it easier for the relatives to decide one way or the other regarding whether to continue or not to continue, whether to try out without ventilators, because I think a lot of fear is there in the relatives also. As doctors, doctors feel, all of us feel that we have this oath that you want to, as far as possible, give the person a better life, at least prolong the longevity. But then that's not the main issue. The main issue is also quality of life. And somewhere there are statistics about how much of a person's total income is spent on health, trying to prolong the last couple of years or last 1 year of life. Somewhere I seem to remember reading that. So we need a balance, I think. And, if we look at things holistically, perhaps we may find some reasonings there, some longer term solutions there. So I would suggest, look forward to tomorrow's discussion and try to be there with us so that we may explore this together. Nice, Dr. Manishi and Dr. Aprajita. Thank you for your observations and questions.
Thank you, Didi. Very important insight that I got is longevity or quality of life. Though we
Yes.
want both, but if asked what will be the priority, then I would go for quality of life.
Yes. But that little bit of hope, that maybe things will work. So let's give it our best shot. I guess there also people get stuck. Yeah.
Generally, we become active in reactive situations. When the health deteriorates at that level, then we go for, that time we remember only allopathy can save us. The machines can save us. The drugs can save us. And then we forget all about what would have been done for a quality life, even earlier stages.
True. Thank you. Thank you all. Very nice discussion. Let me just quickly sum up what we talked about today. So I think for most of us, we felt that there is definitely a need to bring about a change for the better, that there are some real concerns. We discussed about how to address some of these concerns, and what came up was that maybe we need to look at our perspectives differently. Perhaps we need to address things a little bit differently and see where we can go with that. So with that, I think the stage is also set for closing this discussion here. Thank you all for all your time and your engaged discussion. And I invite you all for tomorrow's discussion, panel discussion. So namaste to all. Thank you.
Thank you.
Thank you.
Namaste. Namaste to all.
Guess what? We forgot about the poll questions, Dipesh. I wanted to say that I wanted to share the poll questions, but I forgot about it. Anyway, next time.
Did we
Thank you,
load it,
everyone.
Didi? Actually, Paul, did we load it? No, right?
Not loaded?
No, not
Okay,
loaded
okay.
actually.
All right.
We have not
Fine.
loaded.
Okay. Thank you, everyone. I think we can close here. Namaste.
See, namaste.
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 Namaste, everyone.
Namaste.